Let's be honest, you've probably started more courses than you completed. Am I right?
Yeah, obviously.
Well, that's not a failure. That's normal. Online training is hard when you're doing it alone. There's no accountability, no support, no one keeping you moving forward.
Well, that's true.
So, are you ready for the hack?
Let's hear it.
A real person coaching you.
What?
That's exactly what we've built into our virtual instructor school. We pair every trainee in our coaching track with a real instructor, someone who guides you, keeps you on track, and helps you actually finish.
Like a mentor.
Yes, like a mentor. And do you think that this works?
I would hope so.
Well, we have results, we have data, and those results speak for themselves. Certification rates increased from 28% to 45%, and instructor network participation nearly doubled.
You're literally throwing money away if you don't do this.
Right. Even more telling is that every single person who's certified in the coaching group continued on into YFFR's instructor network. No drop off.
Man, cool.
Yeah, Virtual Instructor School is our full online teacher training, and the coaching track includes 4 one-on-one sessions with one of our trainers.
Nice.
Normally, that's an additional cost of $250, which, by the way, super, like, you and I need to have a meeting and reassess that cost because that's very low.
$2,500.
Yeah, I'm sorry. We missed a zero on that.
Yes.
But here's even the best part, the craziest part, actually. If we didn't think we were crazy before, we're crazier now. You can enroll in the coaching track at no additional cost.
Did you clear this with our finance department?
I did not. But that's why I'm the boss, babe. If you're going to invest your time and energy, finish the training. Do it right. Head to yogaforfirstresponders.org, click the link in our Instagram bio, or check the show notes below to get started. Welcome to Yoga for First Responders on Air, where we break down yoga, neuroscience, resilience, and public safety in a manner that's authentic, educational, and most importantly, entertaining and lighthearted. I'm YFFR's founder, Olivia Mead. As a yoga instructor and neuroscience enthusiast, I'm passionate about supporting first responders and anyone looking to improve their overall human performance. Each week, we'll dive into a new topic and often bring on expert guests to share their insights and experiences. But we'll also keep it real and share our own stories and struggles along the way. So whether you're a first responder or seeking to master the science of mental and physical resilience, this podcast is your ultimate guide to triumph over life's challenges with unbreakable strength and unwavering fortitude. By pressing play, your training has begun.
Tell me a little bit about your work.
Like my job that pays the bills right now. Is that what you mean?
Let's talk about all of it. What fills your days?
Oh gosh. So in December, I actually left my critical care transport job, and that was my identity career. And so I've been on this path now to be what do I want to do when I grow up? That also doesn't drain me. And so I took a salary job Monday through Friday in December, January, and it was just not it was hard to do things at home. I was driving probably 10 hours a week, just, commuting and traffic. And I'm like, this is not it. And so finally what that did, it helped me realize hey, I want to do more in the mental health space or do more with resilience training, whatever we do here. And so I finally enrolled for psychiatric mental health nurse practitioner, which I'll start next month.
Okay.
So with that decision, I have to have so many hours a week dedicated to school. So I took a part-time job in a NICU birthing center. So
Wow.
yesterday, which my background is in NICU prior to getting into transport,
Okay.
but never a birthing center aspect. And so to see everybody, it's kind of insane, just OB stories that you're that's why everybody's scared of OB. And so yesterday a mom came in and she's had all her other babies at home. And but she noticed decreased fetal movement, and she's full term, and the doctor was we're gonna have to C-section. And she was really against it at first just because of her background and what she's used to and wanting home births, but also she knows the reason why we need a C-section. And by the time we got her back to the OR, and I'm still new at this delivery thing. They said, okay, we have to splash her. I'm like, I don't know what that means. And they
Mhm.
literally splash iodine on her belly and cut her, like after the nerve block is done, because the baby was
Like
doing so.
emergency.
Emergency.
Yeah.
Like I'm like, what is that iodine doing? It's just literally splashing on the belly. And then
Say we did it.
we
Yeah.
did it. And I barely had
Yeah.
time to like get my little sterile gown and gloves on to go catch the baby. But yeah, it was. So I'm like, I took this job to be more chill, but now I'm
I
like,
was gonna say, like,
that's
I'm
not.
just gonna grab a part-time job real quick, and it's like
Yeah.
freaking NICU.
Yeah.
Um, what's funny is like I had a C-section and a baby in a NICU as well.
Hmm.
And for someone who's not in your field, that's one of the pinnacle days of my life, right?
Hmm.
That week I was in the hospital was like a huge event, a huge life event.
Hmm.
And for you, it's literally Thursday,
Yeah. Yeah.
you know?
And that was out of the norm. Like normally we like to like the moms can come in and let's play whatever music you want on while you get your medicine and spinals
Yeah.
in. And I have time to like go up and introduce myself to the head of the bed and be like, hey,
Yeah.
Olivia, like I'll be taking baby once the surgeon cuts it out. And
Yeah.
nope, nope. This was like, yeah, the baby had meconium. So it's really bad when like the baby,
Oh, the poopy.
yeah, so that
Yeah.
can get in their lungs. But then she also had the nuchal like a cord around her neck 3 times.
Is she
So
okay?
we had to give her some help for the first 30 minutes, but yeah, she ended up being able to latch within the hour. So yeah, so
Happy story.
yes, so
Yeah, mine wasn't that emergent, so I
no,
was
yeah,
able to play music and all of that stuff
that's
too. But I have to say, like those nurses, I mean, I have so first of all, my dad is one of 12 kids,
oh my
and all
goodness.
the women pretty much are in medical care, mostly nurses. And then one of them was a physician's assistant, and one was a respiratory therapist, and the others were nurses. And my grandma was a NICU nurse
Okay.
and a school nurse, and she raised 12 kids. But anyway, so not only do I have love from nurses from my family point of view, but having gone through IVF and then, a difficult birthing experience, I tell you what, those nurses hold
Hmm.
it down.
Hmm.
I mean, come on,
Yeah.
just like I just am just in so much awe of how they are just keeping everything going. And it's it's just amazing to me. And I have so much respect and awe for them. Like they're just holding it down. They've got it under control. I've never felt so cared for and safe. I mean, it
Hmm.
was just so much respect. And this is one of the reasons that I wanted to offer support to first responders and medical providers because damn,
Hmm.
they're like superhuman. It's incredible. Um, so okay. So let's go back a little bit.
Okay.
Where were you born? Let's
We're going way back.
We're going way back. I want to get a little bit of a foundation of who Jonna is
Yeah.
inside before we took on, like you said, my identity job.
Yeah.
So before RN was your identity, who were you? Like where'd you come from?
So, yeah, so I was born and raised in mid-Missouri in a little town, probably less than 3,000 people. Graduated with maybe 99 people, if that. And, the thing was you graduate high school and they're like, oh, go to college. It's like, okay, but also I have an idea of what I want to do, but also no idea of what I want to do. And so I initially started going for athletic training and realized
Mm,
that because I always loved the body and the systems and anatomy, physiology, but I'm like, I don't know what I want to do with it. And that time I was like, ooh, blood, I'm not going to do nursing, which is comical now.
mm.
Um, and so I started with athletic training. Once I got into the courses, they said it was going to be, it was really oversaturated and you could go be an athletic trainer for maybe some wrestling teams. And I'm like, I've never seen wrestling. Um, and so then I switched to ultrasound technology, which
Mm,
was really cool until you realize there's a lot of physics classes. And I'm like, this is not for me. And then that's how I got into my nursing. But growing up, I mean, I wish we could go back and have our kids grow up the same way, like no internet, like playing outside all day, very small town. I did grow up with kind of a on the poorer side, like um, like I didn't know what an avocado was till I was like 22, just because we
Yeah.
never seen it in a grocery store. I only knew about bananas and oranges, and apples. Some of that fancy lettuce, like the with the purple leaves. Like the first time I seen like fancy lettuce, I was like, this lettuce
Fancy
is
lettuce.
rotten. Yeah, this lettuce is rotten. What's happening here? So just
Yeah.
very small town. But also I think that's made me more down to earth and just like realize that everybody comes from anything. So
Well, this
um
is exactly my point is like, that's not how you present now
mhm,
what you're just described.
yeah.
So, yeah. Okay. So so nursing becomes like the next step for you.
Mhm.
Where'd you go to school?
So I went to school at Maryville University. And so I will say like I went to 5 different colleges because I like didn't know what I wanted to do. I went from athletic training and I switched schools to the ultrasound. And then once I got to Mizzou, which is a very big central like school, I
Mhm.
was like, too many students. I don't like this. So then I bounced back to Maryville University, which nursing school can be very hard to get into. It's very competitive. So like pretty much as soon as you are accepted to one, that's where you go. And
Okay.
so this was a perfect opportunity because it was a weekend and evening program. And kind of just step back a second, I had my son when I was 18 years old. So that
Okay.
also puts it into perspective of he was born and needed a cannula like for a couple days. And so that, I think that like you said with nursing, like the nurses were so great to me, great to him, and it just left an imprint. So
And
got
when
into
you start to go into nursing and looking at the school, how old are you now? How old are you at that point?
21-ish, 22.
So your son's 3 or 4 years old.
Yes,
We
yes,
have a 3.5-year-old, so I know that I'm in it,
yes.
and that is challenging. Were you a
Mhm.
single mom at this point, or
That
did you have
was,
a
yeah.
partner?
Yeah, I had a partner. We were living with my mom and dad, which
Okay.
I'm thankful for. Um, but what's sad is like you said, you're in the trenches and I'm trying to work and go to school. And what I'll always regret, but it was also a necessary evil, was like I had very little time with him. And so I didn't get that full bonding experience.
Yeah.
Um, and so, but it just had to be done, unfortunately. Like otherwise, I would have still been in a little town working at a gas station or something. Who
Yeah,
knows?
Jonna, I feel that so deeply. Eric and I are always balancing the moving forward with work, and all of a sudden we're here working and it's 6 p.m. and her bedtime's 7:30. And as
Mhm.
my parents moved here a few months ago. Thank God.
Yeah, that's awesome.
But I know exactly what you mean, that you're like, oh God, these are the fleeting moments.
Yeah.
So, but also listen, you set up, I mean, he watched you
Mhm.
set up your life. And I think that's also invaluable.
Yeah.
Did you have
Yeah.
siblings?
Yeah, I have a sister that's 13 years older than me. And so like
Wow.
yeah, so like when I was probably elementary school, she moved out and got married and ironically who she married like limited how we saw her. And then so once she got divorced, she started coming back around more and she's one of my best friends now. And
And
then
same parents, even
yeah.
with the 13-year.
Yeah.
Wow. That's so cool.
Yeah. And then I have a brother that's like a year and a half younger than me. And
Okay.
so we fought like cats and dogs. And now we get along. But like at that age, we were just like, I remember like they had to, we would go on road trips to see grandma and grandpa, and they'd set like a cooler in between our seats just so we couldn't like reach over and be like,
Slap each other.
yeah, slapping each
Yeah.
other, like things like that.
Speaking of that, and my grandma, the NICU nurse with 12 kids, my dad always talks about a memory of like them being in the back and just her hand
Hmm.
swatting to see who she could get because they were all being crazy.
Yeah. Yeah, I always tell the story like we would stop at the gas station and we get like a can of soda for the trip, an hour and a half trip. And so like thinking back, that was like a treat back then because we just didn't stop and get sodas. Like now I'm going up to Quick Trip and getting a soda just
Yeah.
just
Yeah.
for the hell of it.
Yeah.
And like Jake, my brother, he would have his drink and gone by the time we would even exit the on-ramp onto the highway, like
Yeah.
just look.
Yeah.
And like I would like savor my little soda like the whole hour trip.
Yeah.
And then I probably did was like, I still got my soda. And like my
Right.
brother, and
Right.
that's how the
Just
fights would start, probably.
egging them
Like,
on.
yes,
Yeah.
like I love my soda. I can still taste it.
It's
Yeah.
so refreshing.
Yeah.
Oh, that's awesome. Okay, so you've got your son, you're living with your parents, and you have gotten into school now, gotten
Hmm.
into nursing school.
Yeah. And so it was a weekend and evening adult program. And so
Okay.
Tuesday and Thursday nights, like from 5 or 6 to 9 or 10 was classes. And then every other weekend was the clinicals. Well, that worked awesome. But also when you go into like a pre-nursing job as like a nurse tech or something, they require you to work weekends. And so I had like a part-time job in an ICU where I had to work every other weekend. So every weekend was full of something. And so it was for 2.5 years, work this weekend, clinicals the next. And like now looking back, like, and I was commuting too. Like I would, like school was an hour away. The hospital was an hour and a half away. And now like looking back, I'm like, I could never, like if you told me to do that right now,
Right. I was just gonna say,
like there's no way. Like
I
if I
remember
had,
doing nutty things when I
yeah,
was younger. Like I worked overnights as a cocktail waitress.
yeah,
There is no way I
mm-mm,
would tolerate that life now.
no. But like I was just so excited. I'm like, well, but we got to do this. There's nothing else to do. And this
Yeah.
was like that. I graduated in '08. And so this was during that first horrible, like high gas. Remember what gas was like $4 or $5 back then?
Yeah.
And like that was back then. That was over almost 20 years ago. And so like no one taught me about credit cards. So what did Jonna do? I got a credit card because there's nothing else to
Hmm.
do to help pay for this gas. And we just made it work somehow. But geez,
Yeah.
like
Gosh, it reminds me so much of, I was actually just thinking this morning about the '08 time frame. And that's when I was first in Las Vegas and showgirl and stuff. And I also had no sense of the world,
mhm.
And so, yeah, it was just like getting it done and, no forethought or real strategy, just like this is what has to be done. So,
Mhm.
yeah, I relate to that. Okay, so you are just burning the candle at both ends, but you're
Mhm.
young, so it's fine
It's
because you're
fine.
young.
It
Yeah,
won't
it's
catch up to me in
fine.
20 years.
Right, exactly. It feels fine at the time, like getting it
Yeah.
done. And when you were in nursing school, were you drawn to the children when you were doing your rotations, or was there anything else you
Yeah.
were drawn to?
Yeah. So those that don't know, like in nursing school, you have each class is a different like area. So there's pediatrics, there's OB, there's geriatrics. Ugh. Like um, so like in my pediatric
Excuse
rotation,
me.
you had the chance to wear like outside of like the normal nursing school uniform, you could wear fun scrub tops. And so I came in with like this Shrek scrub top, and like it was the first pediatric clinical, and the instructor is meeting us, and she's like, okay, well, who's going to be my pediatric nurse? And she looks right at me and she's like, there you are. And I'm like,
Ah, yes.
I
You have outed yourself.
have added myself. And so, but she gave us a tour that first day, and like I instantly felt like they showed us the transport of that hospital. And so they took us to the helipad and the helicopter, and they had a map on the wall of like little pins of where the team had been. And it was like
Mhm.
pins across the whole
Wow.
United States. And like instantly, like then like something clicked. I'm like, that's
Yeah.
what I want to do.
Yeah.
And
I mean,
yeah.
gosh, it's a level of all of a sudden you're in like a Bourne movie or something, because
Yeah.
you're like traveling in a helicopter different places. I
Yeah.
can see where it'd be sparkly.
Yes.
And just
And
so
so,
everyone knows, Eric is bearing witness to our conversation right now. He is
Eric.
here, but I have not let him say a word at all. So,
I am
Yeah.
here. I actually
Yes.
wanted you to say one thing louder for the people in the back, that burning the candle at both ends in your 20s will catch up with you at some point.
Yeah. Yeah.
You
oh,
alluded to
yeah,
that, but that was a
Yes.
key
we'll
to
get there.
say that
Yes.
louder for the folks in the back.
Foreshadowing.
Very, very much foreshadowing. If I only knew.
Right.
Yeah, right. Well,
Um,
exactly. I mean, and that's honestly what I hope people are hearing in this conversation. If they are in their 20s and 30s
mhm.
and it feels fine, is please listen, please understand how important the proactive nature of this kind of training is. So yeah, so we will definitely get to that. So okay, so when you were like light on transport, pediatrics,
Mm-hmm.
it's all started to come together. Was there any sort of idea in your head or given to you or warning or thought that this might be like the nature of what you're going into? Pediatrics and transport, obviously that means they're not doing great. Like,
Right.
yeah.
No, not really. It was more just like you're just like that's the shiny new toy and that's the excitement
Mhm.
and like to get that job. Like I asked right away because like the nurse, I'm assuming it was a nurse that came out and gave us a tour, was wearing like the flight suit and showed us the helmets. And she's like, okay, to get here, you have to have, 3 to 5 years of ICU experience, whether it be like neonatal ICU, pediatric ICU. And I'm like, well, then I was able to get into a senior practicum of the neonatal ICU. And so from there, it was just like, this is where we're going. Like, this is what we're doing. And like looking back, and this is where like, and we can talk about like Station 10 Foundation, something else I'm
Yes.
involved in.
Yeah, I'm looking
Um,
forward to that.
where like in the future, like I want to get this information into just like how you guys are getting it into the academies, like getting it into the
Hmm.
nursing schools, getting it into like um, those new nursing orientations because we don't know some of that stuff. Like, hey, this
Yes.
looks really cool. Let's go to the NICU. Let's go to transport. But on the other end, uh, there's going to be death. There's going to be difficult situations. There's going to be days that, like yesterday, kicked my butt. And while the baby came out fine, like I ate ice cream on the way home. Like, yes, it was like, it's like a balance. Like, well, that wasn't the most nutritious meal, but it filled my cup for the moment on the drive home.
Well, and also I tell people too, that even when it's a good, fun day, whether it's
Hmm.
training or your shift was whatever, the nervous system was still very much engaged and still very much needs recovery.
Hmm.
We're only associating recovery with the bad, the critical incidents, things that
Hmm.
went wrong. And I also think that's where the stigma is coming from with resilience training and wellness associated with like can't handle the bad stuff or something. The best day ever is still an enormous strain on the nervous system. So recovery
Hmm.
has to be a like brushing your teeth
Yep.
versus something bad happened. Now I have to do something. I reminded Lindsay of this, who she do you remember
I
met
love
Lindsay
her.
when
Yeah,
yeah,
she was
yeah,
so
she's
sweet.
awesome.
She
So
saved me.
she got into the academy. She just
Yay.
found out she got her conditional offer for the academy. But when she was doing her training for the physical part, um, she would get done with doing it or whatever, and then she just kind of like sit there, and I'm like, dude, recover. What have I been
Hmm.
telling you? Like you have to sit there and get your breath in control. You have the next thing coming that you have to do. I know it went well. I know you passed. I know you're excited. And now you're forgetting that if you want to do the next thing well, you got to get yourself back to regulation. And she
Yeah,
went through instructor school and she blew it out of the water. She did great. And still, we forget that.
we do.
So
And that's
imagine
what,
not being told at all.
yeah, and that's what I always come back to, like when you taught and about the flow state, like
Mhm.
it is redoing that recovery, because if you don't, then you're just gonna
Exactly.
keep burning the candle.
Burnout is the opposite of flow.
Yeah.
That's what it is. And when someone's experiencing compassion fatigue, meaning I see the emergency in front of me and I can't get there,
Hmm.
you're in burnout because you can't get back into the flow state because you've missing a critical piece of it, which is the recovery, which is not always enjoyable to spend those days like oof replenishing. And we're not taught a training method to do so until now, of course.
Yes.
But yeah, so okay, so you're just you're doing your time and neonatal, you're
Hmm.
putting in the hours so you can get into transport.
Yes.
And so when do you get that job?
So, um, I started my nursing career in St. Louis, Missouri. And so we worked a year there, and then my partner at the time, my husband at the time, got a job on the other side of the state. So we moved. So along with
Okay.
moving, um, I found another NICU to work in for a couple years. We had our second child, who's now 15. And so when I had her, I took, ironically, a weekend option NICU nurse position because you could work weekends, get paid full time, and then have the week off. And so that way was awesome because I could spend all those days with my daughter, raise her, and actually see her. But then again, there was still no days off. Like I was work or home, like taking care of people think, oh, stay at home mom. It's
Yeah,
like,
Eric and I talk about this all the time. It's a full-time job with no PTO,
yep,
no breaks,
yep,
So yeah, it is insane. Going to work is a break from
yes.
parenting.
It actually became, yeah, and that's what it was. I'm like, I'm going to work. Like, I'll go feed someone
Gotta
else's
get out of
kids.
here.
Yeah.
Yeah.
But at least I'm getting paid and you get like adult interaction. But I wouldn't take those years back because now I think that's what makes me sad about like difference between my son and my daughter is like I am a little bit closer to my daughter because we had those bonding years in the beginning. Um, and so yeah, so I then was able to get onto transport in 2013. So I had been a nurse at like 5 years. And what's
Okay.
ironic is because I like to keep burning at both ends and why not keep like growing and changing and all that.
Let's keep it going.
Yeah.
Yeah.
At the same time I had applied for this job, I had also applied for a nurse practitioner program.
Okay.
Because I'm like, if I don't get this job, I'm ready to move up, with nursing or somehow.
Can you explain a little bit about this, like nurse practitioner? I almost have seen them on the same like level as a PA,
Mm-hmm.
like you can basically because and the reason I'm thinking about this is I've been looking for a direct primary care in Albuquerque
Mm-hmm.
because um just a little to clear everything up about New Mexico. Everyone says healthcare here is bad. The healthcare here, by the way, everyone, this is a PSA, is not that the quality is bad. It's that there are so few doctors that it is so hard to get seen. So, but each time I have been seen, the quality has always been excellent. So just so everyone knows. But because of that, I'm looking into direct primary care where you pay like a monthly fee,
Mm-hmm.
and there is one here that's only nurse practitioners. So I was looking into it and they can do everything for you that a doctor can, I mean, like they can, like in terms of seeing your primary. So yeah, just explain a little bit the difference and by going that route, what would change for you?
Yeah, so nursing, obviously, there's a couple different ways to get a nursing degree. You have your associates or your bachelor's, and we all take the same test at the end of the day, the NCLEX, to pass and become a registered nurse. And and then if you want to continue on, you can get your master's in, say, education or leadership, or get a master's with a nurse practitioner. And a nurse practitioner, there's different routes. There's geriatric, there's pediatric, there's family, psychiatric mental health. But essentially, like, and it's every state is different too. Some nurse practitioners have to work under doctors in certain states or have to be associated with them. But they can prescribe, they can diagnose, they can get X-rays and order X-rays and ultrasounds and imagings. And like I do what you're looking for. I pay someone monthly direct primary care, and I can see her once a month, twice a month, every week, and she handles all my prescriptions and um, X-rays and all that because it's just,
I literally just signed up for
yeah.
it, and I'm like so excited because I
Mhm.
looked on the little app and it's like next appointment availability today at
Yeah.
3 p.m. It's like you
Mhm.
can just go and see your doctor. So yeah, it's a great thing to look into.
And what I appreciate about it through the direct primary care route is like my appointments are like 30 minutes long. So
Yeah,
it's not just
yeah,
a pop in, hey, here's my 5 minutes. Oh, you have a headache. Here's your new
yeah,
prescription. So like
right.
she really, depending on where you're a nurse practitioner, where like everybody's different, but she asks how I'm sleeping, how am I eating, gets on to me for
It's
not
more
taking,
holistic.
yes.
Yeah, like
Yeah.
let's look at every part of your life
Hmm.
because there might be something influencing it. And that's exactly what I'm looking for is like, let me tell you who I am.
Hmm.
And then let's see what changes need to be made. So I'm glad
Yeah.
you're experiencing that.
Yeah. So I had applied to go to become a family nurse practitioner, but then I ended up getting a transport job. And
Okay.
I opted to do transport because that's like back to nursing school when I seen the map and the helicopter. I was like, oh, so let's follow that dream. And so 13 years later, I did this job for 13 years and I wouldn't have changed anything about it. I've loved it all. I would have changed like maybe learning about resiliency sooner.
Right.
There's always short staff. There's always sicker kids. There's always weather to combat because people always think, oh, specifically where I did transport, they're like, oh, you're a flight nurse. Yes, but I'm also a ground nurse. I'm also can help in the hospital. And so where I worked, we did fixed wing helicopter and ambulance. And so our ambulance transports were 85% of our transports.
Okay.
And helicopter was only like 5%.
So transport however you get there, like however
Yes.
needs to be. Yeah.
Yeah. But it was
Planes,
critical
trains, and
care.
automobiles.
Yeah, critical care transport, because there is different levels, and Eric probably knows this, BLS, ALS, critical care
Yeah.
levels of different levels of transport. And so ours were
Okay.
critical care. And there we would have ALS calls like, and those were B days like, I just need Lord, just give me just a broken arm today. Like, I just want an appendicitis today. I don't want like the sick kids today.
Oh, yeah.
So, but every day was different. There was no favoritism on who would go. Like, it was just, if your team was up next, you were going.
I think one thing I do appreciate, and this is generalizing, but what I've appreciated about working close to emergency services is that when it comes down to it and there is an emergency, so much bullshit gets wiped away. And I know there's exceptions and, certain difficult people or whatever, but I'm talking about in general, everyone just gets the job done. It kind of reminds me like in floods, you see people helping neighbors, all colors, all different races, all different like economic levels. Everyone just puts that to the side and helps each other. And so I love like, even when I did my academy experience, I wasn't an actual recruit and I was with men who were stronger than me. But when we do an evolution, we were just all in it together. And there was never any weirdness there. All this human bullshit's put to the side for this one goal, which is save who we need to save. And I think that's something that I just enjoy because I just have such low tolerance for drama and bullshit that just getting the job done is something I appreciate. And so I can see, you just next team up, let's go, let's do it. Here's the job. And so describe sort of like let's say it's a great, fun, exciting day and you're feeling good. Okay. Describe what a day is, like that 5% of like helicopter stuff. Like, how did it feel to be such a badass?
Oh gosh. So like the day, it's a 12-hour shift. We only do 12 hours because sometimes these days would turn into 14 or 16 if you got stranded or extra charting and stuff. So a lot of flight jobs are even related to EMS, fire jobs are 24 or 48, but this position was, you were too busy. And so you would come on, you start by getting your bags together. And there's a joke with pediatric transport teams, like, do you have enough bags? No, we never have enough bags. There's like 10 bags. We have the stretcher, we have our oxygen, we have our airway bag, our monitor bag, like medication bag. And I always joke because when I started this position 13 eons ago, we had about 7 or 8 bags, but I could like load them up on myself and like carry them out to the ambulance by myself. But now it took like 3 now like things have expanded and there's bigger bags and more in each bag and like more different fancier equipment. And now it takes 2 or 3 of us to take it out to the ambulance for the start of your shift. And just like EMS and law enforcement, we're out there checking the truck each morning. You're checking your bags. If there's red locks, we would red lock everything that was off. You would have to check the contents to make sure it was all ready to go, because the last thing you want is to be out far away and not have what's supposed to be in that bag. So we load up the ambulance, make sure all your bags are in there, make sure they're secure, because the last thing you want to happen is if you're in a wreck, the bag to become a weapon to yourself. And load everything up, then we would come in for our brief. And a brief is just the start of your shift with your charge person and says, hey, this is what we got going on. These are upcoming transports. This is weather. The aircrafts are all working, or say like the backup aircraft is in place because the main aircraft is getting, a tire change or a blade change or whatever. And then they would let us know, like, is there anything going on at the airport? Like, so say if someone fancy was flying in, like we're in KC, so like if there's a Chiefs game, there's going to be extra planes everywhere at the airport.
Got it.
And
Yeah.
or if there's fancy like politicians flying in, like you can't fly over certain areas, things like that. And so really just get a whole idea of how the day's going to go. And then there's 8 teams on a day, and so they would say, okay, these teams are already out, they've already been XYZ. They might need a break when they get back, so at least you have an idea of where everybody is.
Okay.
And so, and then we carry radios. And so the next thing you would hear would be like, okay, next team heads up, XYZ for pediatric patient. And so then our charge takes the report. And the expectation is to really be out the door. And this will blow some of like the EMS folks' minds, but because really, as soon as the tones go off, they're out. But like, we need to hear a little bit of what the patient is to see if there's more equipment that we need to bring. But my goal is always to be butt in the seat within 5 minutes so we can just roll. And so they dispatch us, and then you could be going for, there's a lot of urgent care and clinics. And so we could go down the road for, like I said, let's say Timmy fell and broke his leg. So we just go down, they got an x-ray, we're going to put him on the ambulance and bring him back. It's a 30-minute trip. Another one we could go, it's kind of it's a funny story that more of these are happening, but it also gives awareness. Marijuana is illegal here. And so there's lots of gummies and foods and things that look like
Oh my gosh.
normal things. And so like,
that is a huge fear of mine.
Yeah.
Yeah.
And so we get a lot of like accidental ingestions. And so one of the ones that I remember going on was we took the helicopter because they didn't know what he took. We knew he took something.
Yeah.
And by the time we got there, he was just so sleepy. He wasn't wanting to wake up. We took the helicopter. We finally were able to get a urine because he was like 3 or 4, but they couldn't even get him to stand up to like pee into a cup with dad or anything. He was zonked out.
Sweet baby.
And unfortunately, a lot of the families aren't forthcoming. They'd be like, we don't have anything in the house. It's
Right,
always
because
the
they don't
same
want to get
story.
in trouble.
Yeah, they don't want to get in trouble. And we would always say like, hey, we're not here to call CPS or do anything. Like, we need to know, like, even if there's not drugs, is grandma's beta blockers in the house? Is there like a diabetic drug that we need to know about? Anything, everything. And it was like, no, there's nothing in the house. And finally we got some urine. We were getting ready. We had him loaded. We wanted to wait a little bit, but we were on crunch time with the pilot duty time. And that's what's hard about this job too, is you have to pay attention to the pilot duty time. And so he's on our stretcher. I have the iPad on, our iPad is our most important piece of medical equipment for these kids, because distracting kids.
You're saying the cartoons?
Yeah, just cartoons, music, all of it. Miss Rachel for toddlers, all that.
Miss Rachel. God, if I knew that like I was being used to like help children in an emergency, I would just be so pleased.
Yeah.
Oh, okay. Yeah. So Miss Rachel, continue.
Yep. And so we put his seatbelt on, and like he does this look. He looks like he turned his head and he's like, hey. And I go, I know exactly what you took. And sure enough, yeah. And so sure
did he
enough,
ask
like
to play the Grateful Dead on the way to the hospital? Then you knew.
But like outside of Miss Rachel, there's also the Dancing Fruit on YouTube, like with like decent music. And so I'm like, okay, we're putting Dancing Fruit on for him. And luckily, like right as we were lifting, they were able to message me and say, hey, UDS positive for THC. And I'm like, yeah, I know.
You're like, yeah, I could have told you that.
Yeah. And but what's hard about that is like we still had to take him and make sure his system was cleared out. Like if we would have known sooner, if they would have said, hey, yes, this is what he got into, like we could have maybe treated, and maybe he wouldn't have to have been flown. I don't know. But that's all in a day. It's like I could do anywhere from one transport a day that would take up 12 to 14 hours, or I could do 4 to 5 or even 6 back-to-back ground transports.
Right,
So
right. You just don't know what your day's gonna hold.
No.
And also you're investigators too, because
Yeah.
especially with children, you're like, what's happening? It's so probably harder to get information, you know?
And that's where sometimes like we would have to play like good cop, bad cop, or even like you said, investigate. And so like I would stay out with the nurse that I was getting a report with and be like, tell me your version. And then my partner would go in and get the family's version. And then we would come together and be like, what's the real
See if
version?
they match.
Yes.
Yeah.
Yes.
You know, there was an episode of The Pit about this. I remember.
Yes. Which that show is a little too close to home.
I was gonna say.
Yeah.
Well, that's actually good to know that there's a show that actually gets it a little bit right. Then
it's to the
because a lot of those shows they don't like get it right. Obviously,
they get it really right, and to the point of like where Jamie, my partner, he's a paramedic firefighter, and so we're sitting there watching. I'm like, this is giving me PTSD. This is making me like I feel like I should be getting paid watching this show. Like, what are we doing here?
Dude, I actually had to stop watching it because it hurt me too much. I mean, it was just like, I mean, even thinking about it, like I'm tearing up, you know?
Yeah.
And they talk about PTSD in there right from the jump, you know?
Yeah.
I have not watched it. I'm of the Rescue 911 generation.
Yeah.
Or the
if you want a reality, like if you want a show that's close to reality but it's not going to give you PTSD, is Tacoma FD. Because that's more like what firefighters are like, but you don't have to cry.
Yeah.
Sorry, Eric, what were you going to say?
Nothing, just that it's interesting a show finally got it right. So for civilians out there, watch The Pit, I guess.
Yes.
Because they watch like Chicago Fire or what, you know, like whatever, Dallas 911.
Well, that one we watched, Eric 911, where there was like a plane that crashed on the beach, and the firefighter took a personal phone call, like while this plane is like
from the dispatcher who was dispatching the call who he was having an affair with, or not yet.
Oh goodness, yeah.
It was like, there's 100 dead people in the water. Like, let's anyway.
Yeah, no one's taken a personal call.
Yeah, so the Pit.
The Pit.
I took us down the TV show path.
Maybe for well, I'm the one that brought it up, but maybe for YFFR certification, you can either do a ride along or watch 4 episodes of The Pit. And
just
then
do the ride along.
Yeah, exactly. I'd rather do the ride along. You'll see less.
Yeah.
Okay, so I also wonder, God, those little tiny veins and on a helicopter. IV. I mean, is that nuts?
I mean, our goal is to have access before we get in the helicopter, because it's not fun to like. There's a lot of vibration. To do it. There's a lot of vibration. There's a lot of sound, and there's a safety aspect too. Like it's really important to be in your seat while you're flying along. So ironically, it's actually like. It surprises a lot of people, but it's almost harder to get one in an ambulance, because the ambulance, they're very big ambulances. But the roads and potholes and traffic and stop and go, like it's more difficult than an ambulance, in my opinion. You might have more room, but and the roads, like and we're in the Midwest, and so post winter roads with potholes and just big rocks, like I'm going to call them rocks, because it's a hot mess, like bumps and ridges. Yeah, it's not fun. It's like
both you and Eric are emergency providers in the Midwest, which is a whole other layer to it, you know?
Yeah. So
Eric unmuted, so I was waiting for him to.
Oh, I was just going to say, like, it's a different world than, like, I don't know, my friends in Phoenix, where it's 110 but never cold. So,
yes. Yeah.
I remember like with academy stuff, we had it was August to December was the academy. So we got really hot and then like really cold. But I got so hot in the bunker gear that taking off everything and getting that of like ice cold was just so delicious. It was so amazing. But it does present more challenges.
Yes. Yeah. And then the winter, it's super hot in the summer, super cold in the winter. And then in winter and spring, winter brings on the snow and ice. Then there's spring and summer thunderstorms that you can't fly in. And so there's just all these different
Yeah.
factors that go into decisions and everything.
That's, I mean, like the cognitive load is like next level,
Yeah.
because you are considering so many factors because like you said earlier, with driving or flying or whatever, there's your own safety to think about. So
Yeah.
you've got to have your seatbelt on, and you've got to so there's that, and there's assessing the patient. And I mean, I one day of that and I feel like I would pass away because it'd just be so much to think about, let alone a freaking career, let alone a career where they're not even teaching you how to remove all of that and process it. So you're doing your thing, you're doing your dream job, it's happening, like I'm just imagining you going towards the helicopter and I'm hearing like the Top Gun music, like saving kids. At what point do you remember the moment something started to sneak in that you started to not feel right and like something fell off?
So it kind of happened twice. Like, so I did leave before. I left maybe 3 or 4 years ago. Because there was also, okay, work sounds crazy and everything else, but then you have the home life. And I was on my second marriage and it was not going well. And so I left. I will say, I remember being in the helicopter and we went for like this postcode teenager and he was doing great. They think it was, who knows what happened? I don't remember, but he was on room air. He flew back, talked with us the entire time. But I remember thinking, flying down there and flying back, like I was struggling to calculate my drugs. I was struggling to come up with a plan with my partner. I'm like, do we want to do this? Do we want to do that? And I like the brain fog started to get heavy and the fatigue really started to fit in or sneak in, I guess I should say.
Yeah.
And I remember riding on the way back and looking at this patient. I'm like, I don't need to be in this helicopter. I don't need to be taking care of this patient right now. Like, thank God, like looking back, like he was cool and was great and just played on his phone the whole time. And that's when I started looking for a different position because I thought it was the job.
Yeah.
Only
And
the job.
right. So, and I wanted, if we were to look inside your brain in that moment, what is happening is you have been functioning in so much of survival, the oldest part of the brain. And by the way, our survival mechanism in our nervous system is our best friend. It loves you so unconditionally that it will do anything to keep you alive before anybody else around you. And so the part that calculates medications and assesses an information, that's the front, the newest part of the brain, cortex. And when we are in survival mode, the cortex begins to take a nap and take its hands off the wheel. And the survival mode puts its hands on the wheel and said, and so that's what you're starting to experience is why can't I figure this out? And I don't need to be here. You're getting out of the flow state where you're locked into what you're doing. So, all right. So you're sensing that and you're starting and by another job, you mean, I think I need to get out of pediatric transport.
Correct. Yeah.
Okay.
And so at the time, like things were not the greatest in my marriage. Like I thought it was like the job. We were also like living in different houses because he lived far away, but like his goal when he told me was like he was going to sell that house, come down. Like that's a whole nother podcast.
You know what? That's when my first marriage fell apart too, was when we were living in two different homes because of a job transition thing. So yeah, it's not funny. That's when it happens.
Yeah. So I took a different job thinking like, okay, I could work different hours, be together more, blah, blah, blah. It didn't matter what I did. That marriage wasn't going to be saved.
Right.
And so, yeah, I thought it was the job only. I didn't think personal life, it'll be fine. Like that doesn't stress, that doesn't lead to long-term PTSD or anything like that.
Right.
And so I took another job and I came back to transport within 6 months, mainly because nothing changed in the marriage. And I took a major pay cut. And like coming back home to transport, it was truly my home. Like my people, I knew the job. Like honestly, I could step in there tonight and just go do the transport. Like it's so ingrained in me.
Yeah.
And so like I tried to leave at that moment. I did. We ended up filing for divorce once I came back to transport, and I ended up finding some major friends and family and resources to help me come out of what that divorce sent me into. Um, um,
We do need to do a podcast episode on this because you and I, it seems like we have very similar stories with this. So yeah.
yeah. And so like, and another great resource is the Stress First Aid, PTSD VA resources. They talk about the signs and symptoms of all this. And so like looking back, I'm like, I checked every box. And so
Yeah.
I tried to leave. I came back and it only got worse. Like I lost weight, the brain fog got worse. I I became what they call like angry cussing Jonna, which is not cool. Like
Yeah.
everything was pissing me off. And I think from a women's standpoint, we could also do another discussion on just anger as women, because I never got angry. I was not an angry person. I was cool, calm, collective all the time, my whole life. And really what I was doing was just holding it in, pushing it down, keeping it in a tiny little box that will never come out
Yeah.
ever.
I've
And
had that same experience in the past too, where I was we could talk about how being raised to be compliant and this and that. And so then I would get to true bitchiness status because I'd be pushed to that edge rather than healthy communication of frustration or this or that. I stayed in that box until it exploded.
yeah. Yeah. And so, yeah, I, at my worst through everything, through personal and work, because I felt like also when I went back, and then you add in COVID and what happened with that, kids just kept getting sicker, patients just kept getting sicker. And then you add on the mental health patients that really amped up too. But at my worst, like with, talking about like survival of the brain, I couldn't eat, I wasn't sleeping, I was losing hair, I was down to 97 pounds. It was not good. Like I had an intervention with my friends from like my personal life friends, and then finally I was able to get some help, and I had to take 2 leave of absences to get the help I needed, between physically, mentally, to overcome the depression, you could say PTSD from the job, not officially diagnosed, but there's calls that stick with us for sure.
And actually I do want to say too, with diagnosed PTSD, I want everyone to know too that when we talk about post-traumatic stress, it really is a function of the nervous system. And a lot of us think it means something out of the ordinary or wrong. It's actually one of the ways that the nervous system makes sense of something it experienced. But when it gets stuck in that, and that doesn't help, and so if you're experiencing nightmares, intrusive thoughts, pain, like physical pain, all these other things, that is part of PTSD, and so we don't have to have this official diagnosis to be experiencing what PTSD is, which is the nervous system trying. I always imagine like an earthquake. I grew up in California, so tons of earthquakes, and the bookcase would fall down and the vases would shatter and all of this stuff. To me, PTSD is trying to get the bookcase back up. Here's this piece of glass. Here's this piece of glass. What was this? Was this a vase? Let me put it back, and trying to make sense of it all. And when it's just too much that we can't put it back together and we're stuck in that, that's when it becomes this long-term, injury that needs more support. But even divorce stuff comes with post-traumatic stress symptoms. And I definitely experienced that. I had a psychologist say, yeah, you're experiencing all the little check boxes of post-traumatic stress because my survival was at stake during that time. So again, like you said, even though not diagnosed, everything you're describing are symptoms of that. And so when this was happening, before you got help, and I want to talk about the help you got, were you still thinking, what were you thinking was wrong or happening to you? Were you still just saying, oh, it's just the job?
Oh,
Or
it was a little bit everything. Like, I had a now ex that was saying, like, was really good at using his words to be like blame game. And I guess I'm going to preface this by every marriage ends with each person having their part.
right,
And
sure.
so, but there was a lot of blaming and a lot of like downgrading my self-esteem. Like my self-esteem was at the lowest of the low. And I tried everything to be like, well, what if we do this? What if we do that? And like, it didn't matter. Like looking back, it didn't matter what I tried to say or do or change. Like it wasn't going to change the fact that he was a chronic affair person. Like he any relationship he was in, just anyway. But like once I was listening to his words go in my brain, like you're nothing or you're not good enough or whatever, then it came into, well, am I a good enough mother? Or am I going to be a good enough nurse? And it was just this spiral down to where literally rock bottom. Like my counselor had said, like, if you come in next week and you've lost more weight, I'm having you be put inpatient and we're going to put an NG down your nose. And luckily I was already starting to work with a doctor and also with one of my other symptoms was I had like this cough, like the palpitations and like this cough, like the cough was like trying to get the palpitations to stop. Essentially it was like this just the nervous system, it was like just crazy, like
Yeah.
yeah. And so and really before I got the help, yeah, I was dragging getting into work. I was not wanting, like, no motivation, not reading, not doing puzzles, not like I was literally like surviving, going to work, coming home, trying to do laundry, try to feed my kids. That was bare minimum. So my counselor, once I got into an intensive outpatient program, he pretty much described it as like passive suicide. Like you're not going to commit suicide,
You're
but
killing yourself slowly,
killing
basically.
yourself slowly, but also you don't care
Right.
if this is the end.
Dude, God, I haven't even thought. That's so interesting because I remember having little phases of my life where I kind of had that same sort of
Mhm.
feeling of like, I don't care.
Yeah.
And so I'm going to eat poorly. I'm going to, whatever. So, wow, that is so interesting to think about. I haven't even heard that concept.
Mhm.
So, yeah, tell me about the support that you got. So you took a leave of absence, and what did you do to get support?
Yeah. So my first leave of absence was post my girlfriends, I call them my soul sisters, like they had an intervention and said, you've lost weight, you look hollow, you're literally skin on bones. Um, like, what are we doing here? And so there was like a 6-week leave of absence, and that's when I went into like um the medical, like it was a functional medicine office. And I said, hey, I need help gaining weight. I need help doing this. Like, and from the functional medicine standpoint, like we did great. Like there was like some, uh, like the adrenal fatigue, of course, related to the stress. There was also like gut dysbiosis related to the stress, but it wasn't like addressing the stress factor. Like I knew what the stress factor was. And come to
Mm.
find out, like, no matter what we did, I was just still at like that 97, 98 pound, like, weight. I couldn't do anything um, until really I found out the day that I found out, like, the ex was truly cheating. Like, I had the evidence. And then within 2 weeks, I gained 10 pounds. And like, just having that little bit of like, oh, it's not just me, or
You're
this is,
not crazy.
yeah, I'm not
Yeah, you're not.
crazy. Energy, and like I can get a little woo-woo, but like energy, frequencies, like it's a true thing. And so once I finally learned of it and like, okay, we're done. Like the day after I found out, we filed for divorce. I'm like, we're done. Like I don't like, and so just that frequency getting, like that low frequency getting away from me. And
Yes.
then like
It's so similar. I know what I just I had that same energy switch. I'll tell
Yeah.
you this one thing real quick. I knew he was cheating, all of that stuff, same thing. But he was being mean to me. So I would like leave him and he could tell that story, and I like refused. So I just sat there and dug my heels in the ground and brought him his coffee every morning, all that stuff. And so I remember he put his coffee down and said, I see what you're trying to do. I'm actually in love with someone else, blah, 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 blah. And I knew all this already. So I calmly said, thank you for letting me know. And I walked up to take a shower so I could shower before I left. Right. And I looked in the mirror and I was so calm and I just smiled at myself. And it wasn't like me smiling, it was something coming through me to say, like, all right, new direction. Here we
Yep.
go, babe. Like, of course, things were so hard after that too, but it was that energy shift of no more of this shit,
Yes.
So I know exactly what you mean. Yeah.
Yeah. Yeah. And so from there, I was able to gain the weight, but I still needed help fixing what was up here because there was the divorce issues, even from because I've been divorced twice, and there was the divorce issues. Then there was like some growing up, trauma from growing up issues, and so then like 6 months later, then I took another leave of absence, and that's where I went into a program called Valiant, and it's specifically intensive outpatient program for. Originally, it was just for EMS and veterans, but they've opened up to healthcare workers. And so I was like the third nurse entering into this program. And they're amazing.
And this is local in Missouri?
Local in Missouri.
Yeah. Okay.
And so like essentially it's led by a guy who is ex-Marine, ex-firefighter. And then the other counselor she's a daughter of a firefighter medic. And so they get us. And so you go into these classes and they make you write about issues, like hand write and read them out loud. And then that's where you truly find that like all of us are all the same in this field. Like we all think the same. We all want to be helpers or service to others. Most of us that came into these fields were, we had a high ACE score. So like we had issues with, whether it be poverty or abuse or not having everything we needed as a child. And so really it helped turn your thinking around. It's cognitive behavioral therapy, but like on steroids with no bullshit. And so like his favorite phrase, like their favorite phrase would be like, you're being stupid. Why are you thinking like that? Like, and so just helping
Let's
you
just cut to the chase.
Yeah. Like instead of help flipping, they flip the way you think. And so I remember like the first week after I read like why I was in there, and he's like, yeah, you're stupid. He's like, you always want to look this way. And I'm going to tell you, look this way. And you're going to be stubborn because I am very stubborn. And you're going to want to look this way. But really what I'm going to have you do is we're going to keep looking this way. But in the end, we'll just turn you all the way back around and I'll have you looking the way I want you to look. And I'm like, whatever. Okay. And it worked.
Yeah. Yeah.
It worked.
Yeah.
So it's amazing. So
how long was the program?
So they want you to do 12 weeks. It's Monday through Friday, 9 to 12. They want you to do 3 days a week. They say the minimum is 12 weeks. I think I did 24. So It just all depends on how fast you progress and if they want more out of you, like if they can see they can get more out of you. And, of course, it's dependent on insurance, and they're really good at like filling out your FMLA and getting you leave of absence because they know it's important work they do.
And after you leave the program, is there sort of support or assignments or way to keep you looking internally even without them?
Yeah. So their plan is like once you leave, like you come in for monthly sessions for like 4 to 6 months. But they essentially say like you're not meant to have a therapist forever. Like you shouldn't ever like I need to go to therapy once a month the rest of your life. He's like, I want you to teach you the tools on how to live and how to be resilient and how to move forward. Because if you're leaning on someone else all the time, that's not good as well. Now I can still like, so I finished that maintenance, but there's still been a couple times, like I went a couple times last year, just a few things like maintenance, kind of like your maintenance for your car. Like just go in and be like, hey, get a little tune up, get me your thoughts, thinking on like, hey, just I want to mull this situation over. Can you help me reframe it or rethink it type thing?
So then can you jump in for a couple weeks and come out? Like,
Mhm.
yeah. Oh,
Yeah,
that's awesome.
they said before, like, if you want to come listen to a couple lectures, just let us know. We'll see what we're teaching. And yeah,
Is there anything like this anywhere else? Like if someone's hearing this and they're like, shit, I want to do that, could they go to Missouri and get it done?
I think
They
it
just
just
have to live somewhere,
yeah.
right?
And I think there are other programs that they're trying to mimic this program because it's so needed. And I mean, there's like retreats, like 7-day retreats or a
Mhm.
month retreat, kind of like detox facilities, but nothing truly that I think is like this. Like I'm very thankful that this was near me because honestly, I don't know where I would be. But I do know, like, I feel like as peer support becomes bigger, as culture shifts, as things are changing, and so they recognize that, nobody's joining these jobs to stay for 25 years anymore. And so
Yeah.
and so the shift is happening slowly, but we just got to get more programs like this out there.
Do you remember like one aha moment where all of a sudden you were like, oh, now I'm seeing everything clearly when you were in that program?
Yeah, we talked about a big class was the ACEs class. So ACEs is
Mhm.
I forget what it stands for, but pretty much there's the scoring system of how you grew up. And if you have a score of 6 or more, you're at high risk for um, mental health issues and whatnot. So the score looks at things
Yeah.
like, did you have food to eat every day? Did you have clean clothes? Did you have a parent that was there abuse in the house, like physical and mental? Was there a parent with substance abuse? Things like this. And I grew up with an alcoholic mother. Um, Clothes were not always clean. Uh, Bologna sandwiches or, peanut butter or mac and cheese or, sometimes like the poor nachos, which are still very delicious. Like,
Oh
like,
yeah,
yeah.
yeah.
Um, and so I had a score of, it was above 6. And it doesn't matter if it's 6 or above, like pretty much 6 is the cutoff. Like it was a very high score. And I think that was a big aha moment because I'm like, well, this is how I grew up. This is normal. Doesn't everybody grow up like this? Um, and so it's kind of like that that story of the two sons with the alcoholic dad. And like the one grew up to be an alcoholic also because that's all he knew, and the one grew up not to be an alcoholic because it's all he knew and didn't want to be like that. And so
Yeah.
it really shapes you who you become as a young adult and now into a medium adult. I don't know, middle-aged adult.
I know. I'm gonna start calling myself a medium
I'm
adult.
in a
I think
medium
that's
adult.
perfect.
Yes. Yeah. Um, And so like that was a big aha moment because he's like the David is his name. He's like, most of you have a high ACE score in here, and that's why you want to become helpers or be of service
Mhm.
to others.
Yeah.
Um and that's also why a lot of us don't later on don't put up with a lot of bullshit.
Yeah.
And because we just don't, like you said, we don't have the time for it. The drama, like
It's almost a privilege to have drama and
mm-hmm,
to have bullshit on your plate
mm-hmm,
is like, oh, well, I'm so glad you have time and space to make up stupid stories and create
yeah,
drama that's not there. So I
yeah,
think that's why I'm a little like salty about that too, is like, oh, good for you, for having that. Like, no, I don't have time for that shit. Let's cut straight to the chase here.
yeah. And so then where it really had it like it came into play too is we have friends, I'm sure we all do have friends that have never had to go without, or they've had the perfect family model, and like thank God these exist. Like I'm thankful, like I'm happy for them that they've had everything they needed to grow up, no abuse, no worry about where your next meal is coming from. And like I hate to sound cliche, but the perfect house with the white picket fence, like those families
Mhm.
do truly exist out there, and they have no idea what other families go through. And so sometimes when I
Mhm.
would tell stories of even kids that I would pick up, like they'd be like, wait, that really happens out there? I'm like, you have no idea
Yeah.
what people are living in or what they're doing to survive. And that's where we have to learn also the no judgment aspect is no judgment of others, but also where I've really had to learn from that Valiant program is no judgment of self, because I would become so hard on myself. And
Yeah.
Cam would be like, why are you being so hard? Because I would say things like, well, I just fed my kids some frozen pizza for the night. She's like, but you fed them.
But you fed them. Yeah.
And she's like,
Well, it's also a testament to you wanting to be different, wanting to be a great mother, wanting to be all that stuff. So you are hard, and you also have to forgive yourself for being hard on yourself, right?
mm-hmm,
Because you're like, well, I want to do better. So yeah, I am kind of picked that I could only give them frozen pizza. Like,
mm,
I mean, if you were just like, yeah, that's fine, that's a whole other thing
yeah,
to look at, you know? So it's like feeling hard on yourself, forgiving yourself for that, knowing you did the best you can. It's just this cyclical thing. And you know, I saw, something I wasn't used to when I helped with the Shop with a Cop program before Christmas. Like each little kid from this community got like $50 Walmart card to shop for Christmas for their families.
mm,
And I helped out with that. And part of it was dropping the kids back home.
mm,
And oh,
yeah,
I just didn't know. I just didn't know. And the last place we had to go, it's little kids. I mean, they're like, and maybe no parents were there at all.
yeah,
And I'm there with the cop, like, well, we can't leave them here
yeah,
at their house without their parents. And they're like, oh, it happens all the time. And I was like, yeah, but I'm not going to do that. I mean, and I
yeah,
just was like, holy cow. It was, and just the environment of the home. I mean, yeah, you just don't realize. And yeah, so you have to look at yourself as that little kid too and do that inner
mm-hmm,
child work,
yeah,
for little Jonna. And so was it around this time that, because now you're going into peer support and you're an
mm-hmm.
ambassador for wellness for the transport nurses. So is that when your sort of new perspective started to change and you wanted to offer support?
Yeah. So our peer support team had already been growing, and I came back from Valiant, like, and it sounds silly, but like anew, like fresh,
Mhm.
ready to like conquer life again. Like, let's do this. And when I first came back and finished, I sent out, I became the well-being ambassador and grabbed on, like, there was already another one, but additional one. And so I said, I'm going to do monthly newsletters with tips and tools, and then be on peer support. And so my first newsletter was pretty much like a testimony of like, hey, this is what I just went through. And while a lot of this stress, PTSD, depression, anxiety was developed at home, there was also a lot of calls from this hard job that we do that led to me coming. And I even said like anger cussing Jonna, because it became a kind of like a running joke. Like, yeah, I remember, because I remember like calls would come in and I'd be like, God damn it, like, why are they calling again? Or like, we know this is a no nothing call and it's going to get me off late, just all those is typically the end of shift type stuff. And so I just laid it all out. I'm like, this was my deal. This is what I went through. Here's the resources. And from that email, I planted little seeds. And since that email, I think I've now have 5 or 6 coworkers that have went through that same program.
Wow, you
Yeah.
made a dent.
Yeah.
You
And
had an impact. That's
yeah.
awesome.
And so when I finally decided to leave, like I sent out another final email, like, here's the resources again, blah, blah, blah. I left, and that next day I got a text from another person that said, I'm in this program. Thank you for being so, you know, transparent, because I don't know. She's like, I was on the path to become an alcoholic. And now I can work through these calls. I can, continue on doing this job and look forward to what's next. So,
I think transparency and vulnerability are key because those are the things that are keeping these resources stigmatized
mhm,
is fear of being seen for who you are and being
mhm,
seen as human. Um, and not only afraid of others seeing you, but you seeing yourself. I describe practicing yoga similarly to what you said he described about looking that way, and I want you to look that way, as I describe it as holding up a mirror to
mhm,
yourself. And we often aren't ready to see it. And so we turn it around and we say, no, it's you that's fucked up. It's you, it's you, it's you, it's this and
mhm.
this, rather than turning and looking at the mirror.
Yeah.
Um, So I think when one person says, I looked in the mirror and I'm back, I'm better
Yeah.
than ever, it allows other people to know that it's safe to do the same thing. So that's just so cool to see tangibly that you had an impact in what you went through. I often notice that a rock bottom in life is also, can be, if you have the right tools, a springboard into like the next awesome level of who you are.
Yeah. Yeah. And that's
So
exactly what happened.
so as you're doing the peer support and the well-being and stuff, at what point does yoga and Ayurveda and the Eastern approach start to come into your consciousness?
Yeah. So I have been a yogi for many, many, many years. And
Okay.
even before like the rock bottom, I had gotten into Ayurveda, and just because I always knew there was going to be something more, whether it be functional medicine or holistic medicine, there's something to be said for like looking at the whole body versus just like, oh, you have high blood pressure, here's a pill.
Right. And I
Um,
want to be clear when we talk about woo woo and how YFR's like not, just taking the woo woo off. By woo woo, I mean that bullshit we were talking about that there's no time for. I am
mhm.
not talking about Ayurveda and true Eastern medicine. So, because sometimes I think people get confused on what I'm referring to as that. So,
Mhm.
what you're talking about with holistic care, Ayurvedic Eastern medicine, that is in no way, in my mind, any sort of woo woo. So, yes,
Yeah.
continue.
Yeah. So Ayurveda typically like it translates to the knowledge of life. Like it's
Hmm.
like the rules of how to live. It's like the medical side of yoga. And it's actually really simple. Like it's hard, but it's like the steps are simple. It teaches you how to sleep, it teaches you how to eat, it teaches you like how to take care of your body. And what's really
Based on
cool,
your constitution, your
yes, based
personal
on
constitution.
yes.
Yes.
But there's also just basics like, and it's really cool to see some of this come in to the wellness space and kind of the resilience space because and and like sleep hygiene, which is really hard for those that shift work, but like also if you can learn about red light and blue light, if you can learn to darken your room, if you can learn certain things of sense, if you really want to get into it, that can help your it's not even tricking your brain. It is telling your brain it's sleep time.
Well, and
Um,
it's also if you have even a minimal time to rest and recover, you actually rest and recover. Because
mhm,
you could have your eyes closed for 8 hours and not be recovering,
right,
or you could have a solid 40 minutes where the system is actually replenished, based on those things you just talked about.
right. And so like I just fell in love with the counseling of others and saying, hey, let's look at these foods, let's look at this movement. Are you walking? Are you even ask about like the spiritual side. Do you have a spiritual connection? And ironically, that's coming into play into the psychiatric mental health world because there's a study out there relating your spiritual connectedness to the inverse relationship of depression.
Mm.
And so that's why it's important to know, like, hey, do you have a spiritual side? Are you connected to self, or are you disconnected? Um, and so I always loved any of that, meditate, all of that. And so when I took my first leave of absence and was working with that functional medicine team, they had a health coach who was actually my yoga instructor, where I got my yoga certification. And I said, I just feel like I didn't love teaching in the studio. It just didn't work for my life, and I just felt like there was something more. And she's like, well, hey, check out, there's yoga for first responders. I'm like, what do you mean? And so like I went home that night and I was like, Google, Google, Google. I'm like, well, how do I get certified in this? Like, this is what needs to happen. Like, because this is, especially when I was in that Valiant class, like it's a group of, I bet there was like 20 to 25 people in there. And I was like one out of, most of the time I was the only girl in there.
Mhm.
And it was all these, I'm going to say this, but beautiful, strong men
Mhm.
that were in law enforcement, fire department, ex-military, but they were always so kind to each other, and they always respectful of each other. And they would always
Mhm.
leave my seat open. Like they knew where I like to sit. And I obviously like my partner, like he's firefighter medic and I love him to death. But then I also found a new love for this connection with the other providers. And so I'm like, there's got to be more to go train with them. And in the transport, like we're like the redheaded stepchildren. We're not fully hospital. We're not fully EMS. We're like this weird little mixture
In between,
in
yeah.
between. And so I'm like, we think different. We don't need, like you said, we talked about earlier, we don't need all the drama and all the bullshit. Like we just want,
Yeah.
give us what works and let's do it. Like,
Yeah.
and so that's where I found you guys and like instantly fell in love because I'm like, okay, what are the next steps? Because we got to do
Yeah.
more, and how can we combine it with everything else?
Yeah. And you know what I appreciate about us, but what is that what the gift I should say that we're giving to someone like you is we've done all the experimenting of how to combine these worlds together.
Mhm.
And so you can just get to work rather than having to invent it like, okay, well, let me pull this and that. Is this going to work? Is that going to work? So if you're raring to go, we're like, here's a formula that we found works. And that's exactly what my hope has been, is that those who are raring to go can just, you know, start it up. So what's cool about you is I think you're one of two people who did our online instructor school
Mhm.
and in person. Oh, and before I get to that, because I do want to talk about this too, at this point, has Rekindled Wellness or your involvement with Station 10 Foundation happened already?
So Rekindled Wellness has already been open and kind of like just on the back burner. Like I wasn't advertising, but like if people would contact me, I'd be like, okay, we'll do an Ayurvedic consult.
So that's like your sort of business around
Mhm.
your coaching or what you're providing.
Yeah. And then
Yeah.
Station 10 didn't happen until this past year. So
Okay. So I do want to talk about that. Okay, so you chose virtual instructor school first.
yes.
And how's your experience with that? Because we launched virtual instructor school like 2 years ago, maybe,
Mhm.
I think, something like that. But I had been against it for so long because of the challenge of learning online. And I did not want to sacrifice any quality. So I'm not going to do like a quick check the box online training. I'm like, this is going to be just as intense, if not more, than in-person instructor school. So what was your experience with it and why did you choose virtual?
So I initially chose virtual because YFFR came out with the bridge program from the yoga teachers to
Yeah.
YFFR. And so at that point in time, I think I was still like on the tail end of finishing Valiant, or like my cup wasn't fully filled for myself to really go out and do a lot of work. But I'm like, I still want to start dabbling. And there was no way I could, I don't think you guys had any classes coming up that were near me, or I didn't have the ability to fly anywhere financially or time wise. And so I'm like, this will work. Like this will help me get my foot in the door, start making progress. And so, I think you guys launched a lesson each week is how it first started.
You were you must have been towards the very beginning.
Yes.
So where it was instructor school bridge course, like you said, and that for everyone's knowledge is we decided that if we were going to do an online course, it was only going to be for 200-hour trained yoga teachers to then give them the, you know, like you said, the addition of the YFFR approach. We ended up changing it open to everyone because we found that even though someone got their 200-hour training, doesn't mean they had any experience teaching, or they may not have had a great training. And we found that people were not like really being able to nail it. And then there were other people who may not have had their 200-hour, but had years of practicing yoga, maybe were athletic trainers and are already instructors, so already knew how to teach in general, and they were nailing it. So we decided to open it up and change it from the bridge course to just a complete virtual instructor school. So yeah, you sounds like you were more in the beginning. We were also at that point launching 1 week at a time. And yes, so continue.
Yeah. And so like I think I struggled because like I said, I was still finishing up Valiant. There was still like my mind was still like becoming back online, I think, itself. But like I would find days I'm like, okay, this is YFFR day. I got to do my program. I got to study, do the book, all that. The part that I did not like is like there was parts where you would have us record ourselves, like voice or video, and then you would have to like listen to yourself or watch yourself. I'm like, this is this is awful. Like,
I
I
know
don't
it
know
is
why.
awful. It is awful. I know.
But it's necessary because
But
there's a
that's the
lot of things.
mirror, right?
Yeah,
That's the
it's the
mirror.
mirror, but it's necessary because you'd be like, why am I saying that word? Why am I going all the
Do you
time?
know
Like,
what's so funny is it when you said that the at Valiant they were like, "You're stupid. Stop doing that
yeah,
way." It's almost like you're saying that to yourself. You're like, "God, stop saying that." You
yes,
know, like
yeah.
you can see it yourself.
And then what was really hard was, because I taught yoga and I taught a stress relief flow, and then I also had the amazing chance to teach yoga 101 to a geriatric population
Mhm.
at a senior facility, which was amazing because they were so grateful. But having to turn off the flowy, flowery way of like, oh, like arms to the sky, and that vocal words of open the chest to, your heart and all those things, and like having to turn
Yeah,
that off. That was the most difficult for me, I think. And it still is to this day because there's still times
yeah.
where I might sub at the local yoga studio and then like I'll go I haven't taught in a while, but like if I go to teach, then I'm like it's more like military, like, okay, button up, Jonna. Like you can't say like
Yeah,
sky.
here we go. Yeah. And I think sometimes yoga teachers hide inside that flowery language because maybe it gives them a persona to be, or maybe there's the expectation for that. So when you take all of that away, all that's left is really the yoga itself. You're actually just teaching. So I think it's a good practice for just yoga teachers in general to take a look at how you're presenting the information. Are you getting stuck in habits or,
Mhm.
things like that? So it's always good for anyone to really, I love Sanskrit and I love teaching in Sanskrit. I loved learning it. And I took it all out to teach first responders because there was more risk and benefit,
Mhm.
But when I would teach back in public classes, I would purposely use as much Sanskrit as possible so I didn't lose it. I was
Mm.
always trying to challenge myself as an instructor to not get complacent in just the. And another thing is if you ever teach outside, I've noticed that some people say, okay, reach for the ceiling. Well, there is no ceiling, we're outside. So are you
Mhm.
being truly, truly present in what you're saying? So when I would teach outside, I'd always make a point to, okay, hands towards the sky, touch the grass, like be present in who you're teaching and what you're trying to communicate with them. So,
Mhm.
you know, yeah, so it's kind of a double exercise there. Not only take the flowery thing away because it's not worth it, but also, notice your habits as an instructor.
Yeah. Yeah. So that's where like the recordings like is a necessary evil. Like and students that like might be listening that thinking about this, like it serves a purpose. Kind of like if people are online going to online school and they have the discussion boards, it serves a purpose. We don't always like it, but there's a reason to the madness of it. And so I was continuing on with the course and I kind of hit like a stagnant point with myself just in life. And then you guys launched an a notification that you're coming to Blue Springs, which is 30 minutes from my house. And so I was like, I just need to get this done. Like,
Yeah.
and then they're coming here. There's no reason not to go. And so I emailed Lisa, which she's a godsend to you guys because she's answered a lot of my emails. And
It's a
I
zone
said,
of genius.
yes. And just said, hey, like I'm in VIS right now, but I want to be able to finish with in person. Is that possible? And you guys were able to make it work. And then I was able to attend like class 037 and it was freaking amazing. So
Who thinks that, yeah, sorry, keep going.
anyone that gets the chance to attend in person to see even like the what do you guys call it? Like the days where you get to go be the like going through
Oh,
the
tech
tax
skills
skills.
day.
Like
Yeah,
that's what sealed it. Like because
yeah,
it made such a big difference with Mark. I was in the house with the smoke and I was ready to like rip everything off. And Mark came through and he's like,
yeah,
okay, you know the tools. And I'm like, they're not here. Like there are no tools. They're
yeah,
gone. He's like,
yeah. They're
um,
government tools. I don't know where I am. Like,
yeah. He's like, okay, in through the nose, let's breathe. I'm right here. It's not real smoke. I'm like, I can't see anything.
yeah,
Um, and so I was able to like breathe through it and not rip my mask off. rescue the little baby and like and get out of the house. Like it was,
Yeah.
yeah. And so highly recommend, if you can only do VIS, do it. But if you get a chance to finish in person and meet everybody as well and get your
Yeah.
connections with your fellow peers, that's like we still are on this text group. And that was in September. So
Yeah, I love that. You guys had such a strong class. Eric, go ahead.
Yeah, I'll chime in here. I have been paying witness to the whole conversation. So if anybody's tuning in, where is Eric been? I have been here.
I know it's
Uh,
a podcast, so no one can see his like head nods and smiles, and he's been encouraging us the whole way.
yes, I'm the silent encourager from the sidelines. No, 037, I will say, has been an extremely it's an anomaly of a course, how tight and close that group has stayed. It was one of our smallest instructor schools because there were only, what, 13, 15
something like
students
that.
or
Yeah.
so. It was at the very bottom threshold, quite frankly, of us to even get like the green light to go ahead with it. But that group of people has bonded, and to your point, has been in a text thread to this day since September. I think we're down to just one person that hasn't certified from that course. Uh, but what I also really appreciate is that, I'll be honest, I forgot that you had gone through VIS or part of
Mm.
it when you came in until even just now, quite frankly, or when Jess was like, hey, we should talk to Jonna because she's done all of our instructor schools as we're in our, because this period where we're talking about instructor schools as an organization. Um, and so what I really appreciate about you though, is you came in, like we say it on day one, like come in with that childlike mind, that beginner's mind. And you did. You didn't come in and be like, I already know all of this, because I literally went through the class in the last 6 months. You came in, like, so open-minded that I mean, I was blown away until I literally feel like I just learned like 2 days ago that you had gone through that bridge course. And so I'm impressed by you, honestly.
Thank
So I
you. Thank you.
appreciate this conversation, taking the time to join us. But in-person instructor school is it can be, I need to clarify this, it can be a transformative experience for people, because
Mhm.
it is a bit of a crucible. It's a lot. We throw people
Mhm.
a lot of things at a lot of people. And the real intention there is for you to come out as a instructor, ready to teach the protocol. And we've had some conversations internally about that. So how do you feel you were prepared to come out to teach, in addition to having the transformative experience, because that's part of it, because then you can talk
Mhm.
firsthand about it and come out ready to teach?
Yeah, I think for me, and I've always struggled with this, was the imposter syndrome, just getting over the imposter syndrome. And like I have the knowledge, I have the know-how, and now it's just getting out there. So if you can somehow add that to your roster of what to teach, I don't know, little magic button. Um, I think too, just uh once you start planting the seeds, I've found that people are ready. Like it's a war, like, and I especially like to tell them like it's a warrior practice. That's like
Hmm.
what gets them. And I actually, it's now my favorite way to teach, because I don't have to worry about music coinciding with it. I don't have to worry about what scents are playing in the yoga studio. It's just the true practice of what it's meant to be. Um, and even like I can do like quick little 5-minute inserts of it. Like if I'm doing a presentation, or if I'm talking about station 10, or if I'm at the booth or whatever, like I can just say, hey, let's talk about this, or are you catching yourself, holding your breath, or things like that. So yes, it truly helped me step onto that mat as more of an instructor, with that motivation, with that command presence as you teach, because it's kind of like, I take it back to being in transport. Like I flip a switch when I was in transport. I would walk into the room or walk into the hospital, and like you're on. Um, and you have a job to do. And so now when we're coming to YFFR, you're talking with departments, it's like you have to flip a switch and be like, okay, this is what we're doing, this is what we're talking about. Um, get on the same level as them, because they got a job to do too, and they don't want to hear fluff. And um, let's give them the tools. So
Yeah, I'm curious. First of all, imposter syndrome is real.
mhm.
It comes down to like anything in life, sets and reps. I'll be honest, like I had severe imposter syndrome teaching this stuff until 2021. And we went on a worldwide tour of instructor schools because all of our 2020 instructor schools got pushed to 2021, and then the 2021 instructor schools happened on top of it. So 21, we had like
There was like 10 in 1 year. I mean, it was insane.
yeah, it was madness. Um, but at the same time, getting to do 10 instructor schools in a 12-month period, just like sets and reps, and finally got to be like stepping my own for this kind of stuff. I was like, oh, so sets and reps, like anything in life, magically defeat imposter syndrome. Number two is you've had fairly good success bringing this to agencies and people. And so I'm actually curious because we hear oftentimes too is like, I can't get anybody to even listen to me. Like, I'm curious, like what, you said you tell them it's a warrior practice. Is there some nugget that you've tripped over or a rock that you've turned over that like is making you successful in these conversations? And this goes out to like other folks that are just trying to start these conversations because people are like, I don't even know where to start. Like, and you've been able to start and
I've been able to start.
I'm just curious, like how you open those doors, I guess.
Yeah. I think what makes my position unique is I will say with clarity, like I haven't been into any department specifically. I've done more like just pop-up yoga things. And
that's a start, right? You're getting
it is a start.
Something out there. So okay, so the obstacle is getting into the departments. So how do I work around it? I'll do some pop-up events.
And that's 100% it. Yeah.
Yeah. And I think with my position in transport, like what made it unique is I got to the point, and even though I was weekend option, I've been in every ER in the city locally in our metro area. And so like after a while, you start to learn and make rapport with all the nurses, the doctors, the teams. They recognize you, obviously the big blue and black flight suit, like you're sticking out like a sore thumb, like they recognize you. And so just remembering people's names and asking them how you're doing. And maybe not like if you're in a code moment, but like if you're just picking up like an appendicitis or something simple, like making connection with people is a big thing. I also did a lot of outreach, like education outreach. So like I started learning names through EMS folks. And I have to give a shout out to my partner, Jamie. He is very connected in the EMS world. Like he just knows how to connect and reach out to people. And so through that, like we've been able to make connections. And so when we post something or anything, like people are like, when is this? When can we come here? How can we help? And so it also goes back to planting the seeds of telling the story. I think just being transparent and vulnerable. Jamie and I were asked to talk on wellness, EMS wellness, at the end of a CIT course a couple months ago. And the guy said, hey, just come in. You'll be the last speakers of this like it was a long course. Like you'll be the last hour of speakers before they take their test and get their certs. And just come in and talk about wellness. And so with that, I just came in, I plugged in YFFR. We talked about breath work. We talked about signs and symptoms of what PTSD or not being your best can look like. And a lot of those signs and symptoms comes from the Stress First Aid website. I talked about local resources, being culturally competent, because what sucks is like if you do want to go see a counselor, you don't just want to go see a normal counselor that's going to cry from, this horrible call that you just ran and wants to know more of the tea of it, so to speak. So like just gathering up all these resources of culturally competent things that can be tools for our local departments. And so I think, and just listening, like, and telling my story, like when we talked at that CIT course, we were transparent and said, hey, we've both been through Valiant. And this guy even popped up and started crying, like, which was so strong of him. He's like, he teared up. He's like, I'm in Valiant right now, and I've been in there for a month, and I've been embarrassed to tell anybody. And he's like, and now I have more confidence to be able to say, like, this is awesome that you guys have done it, because now I don't feel embarrassed anymore. I said, well, it takes a lot of courage to say, hey, you need help. Like help is a very brave word to say. And so
it's trust too. They can trust you now, you know, so whatever comes out of your mouth after that, whether it's try yoga, try this, try that, they're not going to question it because you've established that trust through your own transparency.
Yeah. And so that's honestly why, like in this past couple months, I've made a shift in my job again to become more part-time of where I currently am, because my goal is to be able to get some of these classes out there, because the want is there. Like, I bet weekly over this past, specifically since the retreat, because I've also like shifted my mindset of like, it's needed, it's out there, it's time to do the work, Jonna. Like, get over the imposter syndrome, just do it. And like, once I started saying yes to certain things, people are wanting it. And so like my next step will probably be, I want to like really start doing some pop-up yoga. I've reached out to a studio that's not yoga based, because I just want, like, we don't want any of the ohms or the Buddhas like you've taught us. Um, and so like working with something with that studio, and then I do have some emails out for an academy in the local area. But really, I think just being on their level, just being real, like, we are all struggling, and there's ways to not continue to struggle.
What you're saying about having the conversations, I want everyone to know, who might be considering this and like, how do I implement it? We've created something that has not existed before. So no, there is no block of time in someone's schedule for it. It does not exist already. So it's going to be kind of hard to find time and space and resource and all this stuff to just plug in a YFFR class. We have to be creative, and we have to seep through the cracks. So just like you said, you had time to talk at the end of the CIT course. You're talking about who you are, and you say, here's one of the tools. And all of a sudden you talk about YFFR, and people are like, oh, well, can we do that class? Well, when's the class? And maybe say, well, I don't have one yet. When can you do it? Saturdays at noon? Great. I used to teach at a brewery, just so people would have a place to go, and a brewery called their names, and so then they got access to it. When I started, I've been teaching at the FBI National Academy Conference for 10 years. How I started was a mentor friend of mine was teaching, and he said, okay, the last 10 minutes of my presentation is yours. And I went up there and I gave my spiel. Someone in charge of the conference heard it and said, you get a spot next year.
Awesome.
So it's not going to be handed on a silver platter. The one time it was handed to me on a silver platter was the very first time I offered anything to Los Angeles Fire Department in 2013. And that was the easiest job I ever got. And after that, it was, so you got to like sneak it into all these things before something presents itself. Word gets out, then they'll even be coming to you. But that's when you go, and start pitching it to the academy. And a great example of this too is I've been talking to an academy here who is definitely it's actually where not our last instructor school, but our first local and Albuquerque instructor school was held at the Bernalillo County Joint Training Center. And so they know of us, are interested in us, seeing us there piqued their interest. So they're all about it. But again, there's not a place in the schedule for yoga. So we have to like play around with stuff. So basically my plan is that I'm bringing it up again, because I let the ball drop because of other stuff I've got going on. So I'm going to bring it up again. I'm going to suggest, hey, can I grab one PT time a week, or something like that. And also in terms of the cost, I'm going to find a local place, because some people are doing this under their own job, like if they're teaching within their agency. But if I'm coming from the outside and I don't want another hurdle of cost, I might go to a local credit union and say, here's the cost for your academy, the local academy, the people who are running calls on you, to have this, and would you like to sponsor it? So the fact of the matter is, everyone that's listening, you are going to have to be creative. And the best way to see the opportunity is, like Jonna said, talk to people, tell them your story, tell them other people's story, give them this episode to listen to. But it's the relationships, it's the transparency, it's the beginner mind, and then the opportunity will present itself. But it will take time and creativity. But that's where the passion for this comes in, where you want to get it done. And you mentioned the retreat. So you also attended the instructor development retreat. This is actually one of the reasons we launched it, was because of the VIS course. Someone can have an opportunity to be in person with other instructors and with us as a training cadre. And and have that in-person experience. And also for our instructors, just to get a shot in the arm of getting that inspiration back and that education back. So we do we do make that an opportunity every year to do. And it was awesome meeting you, because I also knew I could see from what I wasn't at 037, but I heard all the right butts were in the seats. And I could see that clearly when you were there, just how locked in you were. And it was just, I was like, yeah, this is the prototype. This is the person I want as an instructor and as a trainee. So
thank you.
All right, so you're having this conversation. The wheels are in motion as we speak. So tell me about Station 10 Foundation.
Yeah.
What is it? What's your involvement in it?
Yeah. So Jamie, my best friend, partner in life, so he was firefighter medic for our local Kansas City Fire Department. Last year, they lost Graham Hoffman to a patient he was taking care of, stabbed him, and he died. Which prompted Jamie to, like, he had always been a speaker out of against healthcare violence, just whether you're in the ER, in the back of an ambulance, like it's just getting more dangerous to take care of people, which is why we went into this training, was we want to take care of others, but now we're in the danger zone. And so from that, he launched the Station 10 Foundation with 3 ideas. One, to let people know, like, hey, there is an issue with healthcare violence. 2, we need to raise awareness and make changes to legislation, like whether it be higher, felony charges, that type of thing, to say, hey, we're done with this. Like, we're not going to work in these type of areas if you're not going to take care of us. And 3, we added on the wellness initiative to it. So whether it be, bringing in YFFR, whether we're bringing in, like, hey, someone reaches out to us for resources, we say, okay, what do you need? Do you want regulation? Do you want relaxation? Do you need a counselor? What do you need because we have a whole list of compiled culturally competent folks that can help you. We're also connected with Rooted Health, which is it's a clinician office that gives ketamine therapy for, well, anybody can come and get ketamine therapy, but specifically for PTSD. But we're working up a budget, essentially, to say, hey, if you need ketamine therapy to overcome this PTSD or whatever you need, like, they are cutting the cost for military healthcare workers and EMS folks, and we're sending a budget aside so those people can go there without having to worry about the cost. Because even a simple 1 infusion can be, I'm going to say, base everything $400. But if we can,
wow.
And I think, I don't have it in front of me, but they need several infusions to overcome this. And so if we can if we can take the budget aspect off, the financial stress of it off, then they're more likely to reach out. And they also know, like, a lot of these companies or businesses that we're working with, we know that if someone is reaching out, specifically a healthcare worker, public safety, if they're reaching out, they've waited a long time to reach out, because it's not normal to reach out. Like, it's a sign of weakness, is unfortunately what people think. And so a lot of the companies that we're working with, like, as soon as somebody reaches out, they're like, we got to get on them right now, because if we don't answer that call right now, they might not call again. And so like, they try to keep certain openings or get them in right away, or whether it be the ketamine therapy, or we're also working with on our list, we have a company that does TMS, like the transcranial magnetic simulation, to help with depression, anxiety. So getting them on that list as well. So,
and this is all local at the right now, because you guys just launched it.
We just launched it, and so, like, we're even still, like, waiting to open our bank account technically, because the IRS is taking forever to send that one little form for a nonprofit. Like,
don't I know it, honey?
Yes. And so we're just trying to do the best we can right now without our bank account yet.
Staying a little under the radar. I've definitely been there. Okay, cool. And you have any links to this, we can put in show notes too. So whatever you started, we'll do. And then when you develop more and more, we can share it, because that sounds like an awesome resource. And one thing I want to end with, because, this past year we have expanded to have a big parent company in order for other high stress, high stakes professions. And I don't want to say professions, I want to say like positions in life, because we were talking about parenting and how it's nonstop, right? Um, what pangs have you gotten of like, do you know who could really use this? Like, have you started to see a bigger picture to who this could be rolled out to?
I mean, honestly, like I'll probably just branch more into that healthcare worker field because
Hmm.
they're so similar and that's who I'm connected to. Um, but also even when I teach, like if I do a sub for the local yoga studio, just teaching it in a different way, because
Yeah.
if I can remind them that like, hey, your breath is always with you, it's free. Like this is how you can just always take a step back. Your breath can be a first word if you're having like if you need to speak, it can be your first word. And so I think just
Yeah.
um and then what's cool is also when we set up these booths and just the public comes up and they're asking about Station 10, like um, I always give little pings out there as well. And also one of my favorite things, I drop it on the ground is one of the things I give out is the little fidget acupuncture rings. Like I just have them laying on the table and they're great for like little fidgets and like they're
Oh,
like
wow.
decompresses the fingers, but like it gets
Uh-huh.
people to come up because they're like, what are these little things? I'm like, well, let me tell you. And then I can say like, hey, let's talk about
Yeah.
like, what do you do for stress relief? Or, are you stressed? Or, this is what our public
Yeah. Yeah.
safety
Yeah.
and healthcare
You get the
workers deal with.
conversation going.
Yeah. So the rings
You know,
disappear at
Peter
every booth.
Levine, yeah, I need to send me what that looks like, because I feel like I
Yeah.
would like that.
Yeah.
Peter Levine, who is the father of somatic experiencing and everything, he says everyone experiences trauma in this life. So we got to take that stigma away immediately, because going through the birth canal is traumatic. Like you start right off
Hmm.
the bat, you know? And so we all need this. There really isn't anyone who doesn't need this. We focus on public safety and emergency providers and all that stuff because it's sort of a real clear example, right? It's this heightened level of trauma, because it's not only we have our own trauma, and then we have people that see everyone else's trauma along with their
Hmm.
own. So it really is for everyone, but yoga for everyone wasn't as catchy as yoga for first responders. So but it truly is, yoga for everyone. And we also try, just like you were doing with the fidget rings, what is the littlest barrier, what is the
Hmm.
lowest hanging fruit, the easiest entryway. And what we've introduced, and we introduced to you at IDR, was the area our readiness score app, area
Hmm.
readiness score. So what did you think of that? Tell me, because we're just
I,
rolling that out and
yeah.
it's so simple, but like, what were your thoughts?
It's simple, but it works. And honestly, in transport, we used to have like a readiness type thing we would have to fill out. Um, the pilots, I believe, still do. Like most pilots in the air transport industry have some type of readiness score because you don't want a fatigued pilot, but for sure. And so it's simple. It takes what, 2 seconds to fill out, and then it gives you a protocol right away. And so that's
Yeah.
what's cool. Like I wear my Whoop watch, and it might say like, "Oh, your recovery sucks," but it doesn't. It will
Yeah.
sometimes give me ideas of oh, go take a walk or go do yoga or whatever. But it's not right there from the app. And what's
In the
nice about
moment. Yeah.
yeah. And so what's nice about this is it's right there. Like, okay, here's my breath work that I can just do real quick.
Yeah.
So
You brought
Yeah.
um,
up
And we'll link. Go ahead.
your Whoop band. I've been
yeah.
working with AI tools because, like, man, it'd be cool if you could integrate with some of the wearables so that when you woke up, you
Hmm.
got your readiness score from your wearable,
Hmm.
and then it automatically gives you a protocol based on that. Like, you'd still do the 6 questions plus an optional line item if you wanted to pull in your wearable devices, whether
Yeah.
what's not. So my brain is spinning on the background on how to take that to the next level for that kind of integration. Because I know so many first responders and medical
Hmm.
professionals are wearing those devices at this point. Like,
Yeah, they
you'd be
are.
foolish
Yeah.
not to try to tap into them somehow. So
Yes.
that little mouse hub up there is turning fast and starting to get a little bit full of smoke. So something's going to have to either
Yeah.
break or get fixed.
Yeah. And like the biometric tracking, like the wearable, there's days that I'm like, I don't need to be wearing this every day because sometimes I'm like, why is my recovery down? Like, what did I do? And then like I get too focused on it. And other days I'm like, oh, like taking my vitamins does help. Like,
Yeah, so
Yeah.
you can see that because it's hard to feel that sometimes. So
Mhm.
it's really nice to be able to see some sort of feedback of what
Mhm.
you're doing is working.
And
Mhm.
I was wearing an Aura ring. Olivia got me an Aura ring for a while, and I was wearing it pretty consistently for about a year and a half. And then I got so caught up in the minutia of the details
Mhm.
of it that it almost became like anti-productive. It was maladaptive because I got
Yeah.
obsessed with the numbers. And so then I haven't worn it for a few years, and I got a little bit soft around the edges, as they say, when we had a kid. And so the ring didn't fit anymore either. So that might be a contributing factor. I don't know.
That's the number one biometric right there. You fat now, okay? Because you can't get your ring
uh,
off.
It could be a
yeah,
toe ring.
but
Yeah, it's all right.
yeah, it's the ring's fault. But but I think what we could do with the readiness score app really is, and I know Aura and Whoop and all those things do this, but really tie it into better trending,
Mhm.
and then shift day versus off shift day if people choose to make that option in there, so they can start to see those metrics because it does make a difference. I don't know. There's just some super cool stuff I think we could do with that.
Yeah, I really like the shift on, shift off because, and I'll be honest, I haven't used it in about a week or so, but like even my Whoop will catch like during that C-section yesterday that I talked about at the beginning. It showed like I got home last night and looked. I was like, "Oh, you were in high stress from this time to this time." I'm like, "Yeah, I was." Like, okay, now what?
You're
Like,
like, no shit.
Well,
Yeah, no shit.
and you actually bring up an interesting point. So as I've been trying to flesh this out a little bit, is actually almost physiological after action reports. So
yeah.
we do hot washes and debriefs on after of our calls and our incidents. And so with wearables, we could actually do a physiological hot wash or debrief of
Mm,
ourselves from
yeah.
like a heart rate, breath. I don't know. I think there's something to that after action, physiological after action piece, rather than even like thinking about trending and that kind of stuff. Like that would be
Hmm.
a cool thing just to surface for people.
Yeah. I agree with that. And I would like that notification, like, hey, let's recover versus you worked a lot just now. Like to even
Yeah,
like the change of the
100%.
words a little bit.
Yes. Like, great job today. Clearly, you were under high stress and you
Mm-hmm.
did something awesome. So let's recover from it,
Mm-hmm.
rather than like, oh, a friend of mine who wears an Aura ring, she was just parenting. She has 3 kids, right? And she just had them at home all day. And her ring was like, it appears you're downhill skiing. Like it's it was like you're doing some high athletic sport. Nope, just 3 kids.
Yeah.
So,
Yeah.
that was very, very validating. And, the point, if this is piquing anyone's interest, we'll put the link in show notes for the red to download the app. It's free. It takes 2 seconds. You put in self-reporting, you get your score, and then it prompts you to a protocol. But what's cool about this that we really want to start to push towards agencies is an agency can see the group readiness of their team. So not individual data. So you can be totally honest if you feel like you're in the shitter that day. But as a team, it can see, wow, my team is at a score of whatever, and maybe one person does bring down the whole score, but it's always the weakest link anyway. We got to get every single person up. And then, the whole team could do a protocol to get everyone's readiness higher. So, so that's another way to use it if you have a team or even a family. Like, let's see how our family's doing today. And,
Mm.
so we did it for IDR, and I actually did it too for this last instructor school we did 039, and we got their group score, and I saw that around midweek they were at 67. So it was like, okay, yeah, we're tired. Why are we at 67? We're tired, so
Mm-hmm.
so that's another cool way to use it. But Jonna, I've kept you here long enough, 2 hours. So sorry, but you are just so cool to talk to. Because it's so cool to meet someone who is such a high performer, took responsibility for their mental health, came out the other side, offering it to other people successfully. You're in a beautiful partnership, it sounds like
Yes.
now. And so it's like, and you're just absolutely like beaming and a gorgeous woman. And it's just like, damn, look at this person. This is exactly what we want to see, is you went full circle and you're just so cool.
Well,
You're the
thank you.
coolest.
Thank you. It's been a pleasure. These past 2 hours, I could talk to you guys forever. So
That's how I feel too. I mean, went quickly, and I hope that I know people will get something out of this, especially
Good.
those who are considering training. You did a really good snapshot of what it's like. It's hard, but there's a reason behind it. It's worth it. You offer it to others, and like you're doing, you will make an impact.
Well, thank you. Thank you. You guys are making an amazing impact. Keep doing what you're doing. So
Thank you. All right. Well, we will talk soon. I appreciate you and have a great weekend.
all right, you guys. See you guys. Have a good rest of your day.
Hey, before we go, I want to remind you that training your mental and physical health is incredibly important, especially for those working in high-stress jobs like first responders.
And if you're interested in learning more about yoga for first responders, visit yogaforfirstresponders.org for our on-demand training app, online course platform, in-person training, and more.
Like this podcast, subscribe, and give us a great review. We are so happy to have you part of the YFFR mission.